of my peace. You are my joy, you're my everything. All that I am, all that I'll ever be is a result of who you are to me. My heart's desire is to do your will, to pursue your purpose, your plan fulfilled. My soul's delight is to follow you. My goal, my purpose is your will to do. All that I am, all that I'll ever be is a result of who you are to me. All that I want for people to see is the image of I am in me. Every day I live to see. I thank you, God, because you let it be. The breath I breathe is life to me. Everything you are is what I wanna be. Yeah, yeah. All that I am, all that I'll ever be is a result of who you are to me. All that I want for people to see, yes, is the image of I am in me. All that I want, all that I'll ever be is a result of who you are to me. Yeah. All that I want for people to see, yes, is the image of I am in me. Yeah. Oh, is the image of I am in me. It is the image of I am in me. Yeah, yeah, yeah. Is the image of I am in me. You are, you are, you are, you are.
It's Friday Night Live with Cat Carter. Get ready, set, let's go. Come on. It's Friday night. It's Friday Night Live. It's Friday night. It's Friday night with Cat Carter. It's Friday night. Hey. It's Friday night. It's Friday night. Yeah. It's Friday night with Cat Carter. It's Friday night. It's Friday Night Live. It's Friday night. It's Friday night with Cat Carter. It's Friday night. Hey. It's Friday night. It's Friday Night Live. It's Friday night with Cat Carter. 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 With Cat Carter.
Hey, welcome to Friday Night Live. I am your host, Cat Carter. How are you all doing this evening? OMG. I am so excited tonight. I have some of my favorites here visiting with me tonight. Tonight, we're going to be talking about the joys and the challenges and the journey of getting into dental school and what it takes to be successful and completed and all that good stuff. All right. So, Friday Night Live is a positive platform where we come to inform, innovate, and inspire. So, if you all were here with me last week, we were actually talking about medical school. Tonight, it is dental school, and I have some wonderful guests that I want to introduce you to. Now, you know the show goes kind of fast. So, I have kidnapped one, two, three, four of them. I have kidnapped them for the entire hour. Please welcome to Friday Night Live, Dr. Cornell Thomas Emeritus, Dr. Roderick Jordan, Eric Crosby, and Alon Love. Here they come. They're coming. Are they coming? Where are they at? Wait, where are you at? Wait, I can't get them out here. Let's see. This? Oh, okay. There's
There you
Dr.
go.
Thomas. All
You
right.
gotta let us in.
I'm trying to get y'all in here. Okay. All right. Where? Roderick? Erie? Whoo, child. Got everybody in here. Oh. Dr. Jordan, what you? Oh, there he is. There he is. Hello, everybody. Hello. Welcome to Friday Night Live. It is an honor to have all of you on the show. I don't take it lightly. I know that you all have busy schedules. So let's just dive right in. What I want to do first, I want each of you to tell the people in the chat a little bit about yourself, what school, dental school you went to, what's your specialty, and if you're a student, you could tell them, what year you are. And we will start with Dr. Thomas. Then we're going to go with Dr. Jordan. Then we're going to go with the D2 and the D3. All right. It's all you guys.
Okay. Hi, how's everybody? Anyway, my name is Dr. Cornell Thomas, and I'm a professor emeritus. I used to be the assistant dean or dean of students at SIU, School of Dental Medicine, and I was there for 40, 44, 45 years. Now I'm back. I retired, but I came back and I'm working on Thursday. Anyway, I didn't graduate from SIU. I graduated from the University of Missouri at Kansas City, but I feel like I'm a part of SIU because I've been there so long. And I can tell you that it's a great school, and we really deal with uh, complicated issues, but we make it fun. Our students are good. They work together. And like I said, it's just great to be here.
Thank you, Dr. Thomas. All right,
All right.
Dr. Jordan, you're up.
Yeah, I'm Dr. Roderick Jordan. I went to SIU. I graduated in June of 25, so brand new dentist. Um, I work in a general practice in Maryland Heights, Missouri. So I kind of do a mix of everything within the dental field.
All right, Ari, you're up.
Hi, everyone. I'm Ari. I currently go to SIU School of Dental Medicine, and I am a D2, so I'm a second year dental student.
Last but not least.
How are you guys doing? My name is Alon Love. I'm a D3 at SIU as well. I went to school undergrad at SIUE, and yeah, I'm D3. So.
All right. Okay. So the first question, what motivated you to pursue dentistry? Was there a specific experience? Was it a shadowing thing? Any one of y'all can dive in and tell us a little bit about why did you choose dental school above medical school or vet school, or what is it about dentistry?
Well, I'll take this one, and then I don't want to monopolize the conversation, but I always wanted to be a dentist. I didn't want to go to medical school or vet school, and mainly it was through the dentist that I went to. I admired him. He was not just a gentleman, but a gentleman, and he just did great work. And when I was going to him, I asked him about it, and he mentored me. I think he went to Meharry. Yeah. And but I ended up working under him in a building. I was in St. Louis, and I started as the youngest person in the building. And when I retired, I was the oldest person in the building. So, but he was just a great mentor and a good friend.
Anyone else?
Um,
Yeah,
you,
I can go. I'll go. So
go
for
ahead.
me, I always wanted to be a doctor. I think when I was in like sixth grade, I always wanted to be, for some reason, I wanted to be an orthopedic surgeon. I broke my arm, and that was what I wanted to be. But then as I kind of started shadowing a dentist who I also had been shadowing that had done my braces in the seventh grade, I ended up getting more drawn towards dentistry, um, and the relationship that you build with the patients. I like the environment there a lot, so I think that's what kind of drew me in as well.
Okay. Anybody else?
I'll go. So for me, I knew I wanted to do something in like the healthcare field. I just wasn't quite sure like what exactly I wanted to do. I did have braces in like my freshman year of high school, which was like kind of considered late.
Mm-hmm.
Um, and I was just so like interested in the whole process. Like most people would complain about having to get their braces tightened, but like I was just so excited with every appointment. And I was just like I was really into the process of like what the brackets did, what the wires did, and I would like go home and like research every step after my appointment. So like that was kind of my first inkling that like I might be interested in dentistry.
Okay. Alon?
And then for me, I really didn't know what I wanted to do until I got to like high school. So like my junior year, my aunt ended up getting me this job at her oral surgery office, and I got a chance to like shadow with the doctors and stuff, and get a chance to like get a feel of like oral surgery and stuff like that. So that kind of interests me, just seeing like the instruments, being able to um, the surgical aspect of it kind of interests me. So that's kind of why I like pursue dentistry and go into there. So
Okay.
those.
How did you decide what dental schools to apply for?
So for me, I guess I applied during COVID, so I kind of already heard a lot. I'm from St. Louis. I heard a lot about SIU. So I was like, I'm gonna apply there. I think I kind of just picked schools that were close, schools that I thought were really great, and then of course I also applied to like some HBCUs. SIU always heard great things about the clinical aspects and things like that. Um, I applied to Meharry and Howard, and I applied to AT Still. So I only applied to four schools.
Mm.
Yeah, I heard about, because I also went to SIUE, and I heard about pretty much them, just got that off of them. Um, that's pretty much how I got connected to going to school, like applying there. And then also just like heard from other schools that like UIC. I pretty much just wanted to stay like in Illinois just a little bit, and then I like
Mm-hmm.
applied near other family members. So that's kind of what I did in terms of that.
Okay. Dr. Thomas, this question is for you. What should pre dental students focus on during undergrad to strengthen their chances of getting into dental school?
Well, one of the things that we're looking for is a well-rounded student, and I would take uh, a heavy load. In other words, 15, 16 hours,
Mm-hmm.
and take a lot of sciences. I was a biology major, and but you take your science courses and that, and then you deal into some extracurricular activities. I played baseball, you know, and I played baseball for 4 years, and I think what we look for as in an applicant is someone that can multitask and take full loads and show that they can deal and have a good average on a full load.
Mm-hmm.
So I would take the biology courses, take the chemistry, the physics, and take some other fun courses too. But I mean, and then do well. You
Mm-hmm.
know, so just like I said, mostly it's a well-rounded student is what we're looking for.
Okay. These the next one is for the students and Dr. Jordan. How would you describe the transition from undergrad studies to dental school, and what was the most surprising aspect?
I would, I would say definitely the workload. It was definitely for me personally, like undergrad was already like it was sort of challenging anyway for me until like I adapted like later. I'm a late bloomer.
Hmm.
But even like getting ready to transition into like dental school, I'm like, okay, now I gotta like get a whole new study strategy on how I need to approach things. And then that kind of like was difficult towards the beginning. But I think like over time, like adapting and asking questions and like getting to know my professors and try to figure that stuff out, that's like kind of what helped me be able to adapt to those kinds of situations. So
Okay.
Yeah,
Anybody else?
for me, um, it was kind of rough just because like I found out that I wasn't as organized as I thought that I was. And yeah, like you have so much coming at you at once that you really got to get like a solid routine down. Otherwise, you'll just feel like you're going crazy. So it was a little rough, but like eventually I found my groove and I was able to like keep up with everything.
Okay. Dr. Jordan,
Yeah,
what about you?
yeah, I always kind of compare it to, at least my experience in undergrad was the transition from high school to undergrad was very similar. Like you come in and there's no one, the responsibility is all on you, so you're getting used to not only the responsibility, but like Dr. Thomas mentioned earlier, the workload.
Hmm.
Um, and figuring out, well, you can't kind of when they prescribe you with like the objective to learn and outcomes, it isn't just, oh, let me just skip past these things
Yeah.
and I could just skim over the notes and get through it because you kind of find your way to like binge and purge in undergrad where you just kind of force learn these things and you don't learn them, you just kind of memorize them. Wow, in dental school you go from just memorizing them to learning them because you have to be able to apply them, think critically about them. So that kind of was the next major step I think between going from high school to undergrad and undergrad to a doctorate program.
Okay. Dr. Thomas, what are some common mistakes you see students make when applying to dental school, and how can they be avoided?
Well, the common mistake I think is that some students just they don't really apply themselves
Hmm.
and say the right things, you know. So I'm thinking that when you when you do your application, just make sure that you got good letters of recommendation and you say what you mean and you mean what you say. In other words, okay. And then when you come to the school, and you're going to be in front of a lot of people because we don't do just one interview. You
Hmm.
know, there's 4 or 5 folks that might interview you. You go on a tour and that sort of thing. Ask questions and you know and just be concerned. You know, a lot of times folks will come there and say, well, you know, I want to be a dentist, and they're going to ask you why. You know, and sometimes you know you ask that question and folks have to think about it. I mean, they're looking up in the air, and I mean, one guy had said, "Well, I just want to help people." You know, that's what,
Hmm.
well, and then you look on his resume, and he's never done anything in his life to help anybody but himself. You know, so you know, just and that's the part. It's from the heart. You
Yeah.
know that you have to speak from, and just go along that way.
Okay. This is for everybody. What's one thing you've learned in dental school that you wish you knew before you started?
Well, I could tell you, and it's just like uh, Dr. Jordan said that it's the number of things that you have to do. You have to be organized, and you have to know stuff. And yet your studying is different, you know,
Hmm.
because you have to know things and know it cold. Because by the time that you're treating patients like Elon is doing, you know, um, you have to, you know, when you're in the preclinic, you know, if you dig too deep or your prep is too wide, you can throw that tooth away and start over. Well, you can't do that on a
Yeah.
real patient. You know, so you have to know this stuff and know it cold and be able to regurgitate that information back to people. And because you can't fool the public. You know, they'll know if you're jiving them,
Hmm.
you know.
Yeah. I'd say time management,
Yep.
because that was very key for me in the first year in dental school was, I thought in undergrad I was studying hard because I would study all day, but then I came to dental school and realized that a lot of that time was not very important. Um, I didn't do a good job of studying the correct way. 'Cause I think I learned I had to learn how to learn all over again
Oh wow.
because in undergrad I just kind of just stared at the sheet of paper until like again like I memorized it. Well, in dental school that did not work.
Mm,
That was very bad. So then once I learned different ways to study, different ways to actually retain information, that's when I think I kind of excelled and did a lot better.
okay. Anybody else?
I'd say like not comparing myself to other people. I've always like sort of did that like even if it was just like minor in like undergrad or even like high school and stuff like that, but it got like really bad towards like the beginning of dental school where like I would just see somebody do better on a prep or somebody got a better test score than me and stuff like that. But when I had to realize that it wasn't it shouldn't be me versus everybody else. It should just be me versus me the entire time. I need to make sure I want to improve and make sure that I want to do better um, at the other obstacles that like come my way. And I've gotten better at doing that. And here and there, you'll see yourself comparing, but I
Yeah.
think that's just like one thing that I would just focus on, or like I wish I knew more. Just focus on me, pretty much.
Okay. Anything, Ari, on this question?
Yeah, I'll just say kind of like what Rob was saying, like the memorization is just not going to cut it no more. Like you're going to have to know your foundational things. Like you're going to have to know it. So, yeah,
Okay.
that would be the one for me.
Okay. This is for Dr. Thomas. Is having a mentor important during this process and why? And how important is volunteering and shadowing for your application?
Having a mentor surely helps. And, volunteering also helps. All that kind of information helps you. I mean, you can't, kind of fool everybody, but you got to have a good background. You've got to study hard. You got to listen. A lot of times folks just don't listen, and you have to do that. You know, and you have to be able to take it. Because someone shows me a prep and says, "Is this good enough?" Well, I mean, is that something that you would put in your mother's mouth or your father's mouth or your sister? I mean, you got to demonstrate your capabilities
Yeah.
and do it well.
Okay.
Can I piggyback off that?
Absolutely.
Yes.
Yeah, I definitely agree with like having mentorship and stuff like that. So again, I like while I was applying to like getting ready to apply for like an undergrad, didn't know what I didn't know how to apply, didn't know how to do any of that stuff. Then my aunt ended up like reaching out to this doctor. His name's Dr. Bell. And he, after I reached out to him and got like advice from him, he just like kept it 100% with me. Instead of sugarcoating everything, he just told me exactly what I needed to do. Pretty much everything that Dr. Thomas was just saying, like have a better foundation, make good grades and stuff. And I don't know what happened. Like literally right after that, I just started making good grades and doing that, and then applied to school. And not even just that, I feel like myself, like networking and like meeting other doctors and stuff like that, it helps me on how to think as a doctor and try to like how I should approach things. So I definitely agree in terms of like having a mentor that definitely helps you out a lot.
Hmm. Okay. Carrie Newsom is on in the chat. She says they are telling the tooth, the whole tooth, and nothing but the tooth. That's cute.
Yeah. Yeah. The
Okay.
tooth shall set you free.
Okay, so here's a question for everybody. How do or did you manage the stress and heavy workload of dental school?
Well, I can tell you that I've never been a person that can cram for a test. I would study, and I would put it away and study again, but and maybe start with one course, and then even come back to it. And you have to be able to, you can't, someone that says that, well, I just studied all the time and that kind of stuff. Well, I mean, they're fooling themselves.
Mm.
So, I would work through the week, and on Friday, like Friday evening, that was my time, to deal with whatever. And then I was doing laundry or something like that on Saturday, but I always had a book in my hand,
Mhm.
So you just really have to apply yourself. You have to be organized, and you've got to ask questions. If you're studying, I wouldn't study on a bed, because or having TV on or something like that, because you're fooling yourself. I would go to the library, and study, because where I was staying was too noisy. And so you have to just kind of get organized, and do things that way.
Okay.
Yeah. This is funny because Dr. Thomas had that same statement to me my first year when I came in there and I didn't was like, dang, I can't study anything. He's like, well, where do you study? Like in the bed. It's like, what do you do? Just study and study and watch TV.
Yeah,
He's like, you're fooling yourself. But
yeah,
I
yeah.
mean, yeah,
Football
those are
games
those.
on.
Those are very important like points
Yeah,
for sure that he's making. And again, like even with him saying that, like to me as well, although I did take, I took that in, also like I have to study with noise around, and then I am a procrastinator, and I just kind of like adapted that to my mindset and know that that's just what I'm gonna do. I'm gonna study like crazy the couple days before. um, Similar to Dr. Thomas, I didn't study on the weekends except for on Sundays. That was kind of my cram day. I just would cram everything in on Sunday. And also learned a lot by just through the week. Like I may not have picked up a book per se all the time. Like although I did study through the week, I probably didn't do a lot of hours
Mhm.
through the week. I think the way I taught myself was by helping other people. So what I learned, I would kind of talk through everything with people, and then they would give me little pointers at the same time. So I think I learned just from communication with, and when I was the D2 helping the D1s or D3 helping the D2s, you kind of not only did it refresh your information, but also help you pick up new information at the same time. Um, and I think that's kind of worked for me, honestly.
Okay. I want to hear from the ones that are still in dental school. How are you handling the stress and heavy load of dental school?
You can go ahead.
Thanks. So for me, I try to make sure like that I'm still doing stuff that I enjoy and I'm not just doing like strictly dentistry. Because I don't want to like burn myself out and then like from there it just goes downhill. So like on the weekends, I'll like do some self-care. I really like to paint, so I try to like get in a little drawing, a little painting every so often. Um and also I like to like work out a little bit. So I try to just make sure like I'm still doing other things outside of dentistry.
I completely agree with her too, in terms of just making sure to like take care of myself at the end of the day. Like I know some people, like some of my classmates, they'll study for like till like 2 in the morning. I'm not doing that. That's like I can't like function and like off of like a couple hours of sleep and then gotta get up the next day. It's like I'll just do my own thing till like about 10 o'clock, and then like on the weekends I'll like do things that I actually do enjoy. Like I'll be like around family and friends and stuff like that, or even just I like to write. I like to just do stuff, just be able to have like some type of thing that I enjoy for myself, so I don't end up burning out and end up over stressing. So definitely taking care of yourself is like I think the one thing to de-stress and
that's
deal with it.
important. That's important.
Yep.
Hmm.
Yep.
Okay. Can you share a story about a mistake you made during your training and what you learned from it? Nothing yet.
Hmm.
That's good. Can you think of anything, Dr. Jordan or Dr. Thomas?
A mistake that I made and something I learned. Repeat
Yeah.
that.
Uh, a mistake you made during your training and what you learned from it.
Well, I would say a mistake that I made was, just being late. You
Oh,
know,
yeah.
yeah, yeah. And then, when I was in school, if we were late for class, the doors would be locked. You couldn't just kind of get in, you couldn't just barge in at any time and that sort of thing. And so I, just didn't want to be late. And like my dad used to say, I would get there 15 minutes early because if you're not there 15 minutes early, you're late, you know. And that was something that I always remember. But you learn from things, and you just try to do your best and be respectful, and you'll be respected. Don't try to do the shortcuts
Mhm.
on stuff, and just always do your best. That's really important, and for you to get along.
Yeah, that's good.
Yeah, I would say it would be like self-confidence and second guessing. And I think those kind of go hand in hand because a lot of times in the training you might actually know what you're doing, but then think that you don't and do something else. And also like when you start treating patients or especially like even out in private practice, um, patients can pick up on whether you're confident in what you're telling them that they need. Um, and they're gonna take what you say, and because you're not confident in it, they will feel like they don't need it. Even if you know that that's what they need, if you're not confident in the treatment plan, then they're not either. And the downside of that is now your patient is without care. Your patient is not being treated for the things they need, and the outcomes of that could be, detrimental long term. Whether that's needing a tooth pulled, whether that's needing a root canal,
Mhm.
those are a lot of things, periodontal disease that can lead to other health issues. So if you're not confident to stand there and say, hey, this is what you need, this is what the problem is, this what needs to happen, then you kind of defeat all the training that you have learned because you're not able to communicate that.
Okay. Okay. Let's do one more question before break. This is for Alon and Ari. Looking back at your pre-dental journey, what was the biggest obstacle you faced, and what advice would you give a student preparing to apply to dental school?
Hmm. I think for me personally, I feel like while I was applying, I was like running short on time, like to prepare my application to study for the DAT. I felt like I was like under a lot of pressure to like kind of rush and get everything done.
Mhm.
So like looking back, I would have just made sure like that I got that schedule figured out ahead of time so I wouldn't feel like so much pressure because taking the DAT is already super stressful. Just applying in general is already super stressful. So like just being better prepared with that whole timeline of the application process, like that would have helped.
For those of people in the chat that don't know what the DAT is, tell them what that is.
So the DAT is the dental admissions test, and you have to take it to up. Well, you don't have to take it to apply, but you have to take it. Most schools require it to get into dental school. So it's just like a standardized test of like biology, chemistry, stuff you would learn in undergrad.
Okay.
Yeah, folks go to all different schools, and that's one of the things that everybody has to take. So that's something that we can kind of compare with other schools.
Okay. Alon, looking back at your pre-dental journey, what was the biggest obstacle you faced, and what advice would you give a student preparing to apply to dental school?
I think me in terms of like overthinking things, and I think just like just like applying to like dental school and stuff like that, I would like sort of second guess myself like, oh, I don't think I did good on this specific thing, or oh, I don't have like a high GPA, or I don't this that and the third and stuff like that. And again, it comes back to just like comparing myself and stuff like that. I feel like that not having that like overthinking and stuff, and actually trusting the process, actually having confidence in yourself, and giving yourself grace. Like, hey, I'm doing this, I'm doing that, stuff like that. I feel like applying all of those into like one thing, I feel like it'll definitely benefit you in the long run for sure. Just self-confidence, self-love for sure. And yeah, I think that's what would have
All
helped
right.
me better. So yeah.
These are some great answers. And I just want to thank each of you on the panel right now for your time and giving us this information. We're going to take a quick break. I'm going to put you guys backstage for probably about 5 minutes so you can drink some water, take a little break. And on the other side, I have a few more questions, and then we're going to open it up to the chat to see if they have any questions. Is it okay?
Okay.
Yeah,
Okay.
works.
So I'll see you guys in a minute. Let's see. All right. Are you all enjoying the show tonight? Let me get this off of my lips. Okay, there it is. All right. We are cracking, we are beneath the surface, and we are looking at dental school, what it takes to get in. We're talking to Dr. Thomas, Dr. Jordan, Aria, and Alon. And I'm just so excited to have all of them here. What we're going to do is we're going to be giving something away tonight. And then I have a few announcements. Let me do the announcements first, and then I'm going to put the trivia up there for your chance to win. Tonight, I'm going to be giving away. This is a tooth candle. And also a notebook so that you write your good things in. Okay. So that's what's for grabs tonight. So stay tuned for that. All right, here we go. Let's talk about this. Okay. So if you are in Memphis, if you all were on the show about a month ago, saxophonist Crystal Brown, they're going to be doing a resilient entertainment with sax lady who is Crystal Brown and the Soulful Friends. They're going to be honoring the memory of Charles Wilson, which is her brother. He was very involved in music and everything, and unfortunately, he died of AIDS, HIV. So this is going to be a wonderful show. They're going to have entertainment. They're going to have comedy. They're going to have fashion. So please come and support. All the proceeds are going to go to a foundation for people that are affected with AIDS and HIV. All right. Also, I have, let's see. Let me see.
Let's go!
All right, that is actually my graphic designer. He does my all of my promotions on my flyers when I do concerts, all that stuff. And so, if you're interested, they're giving a 30% discount off if you want to have some enhanced pictures of yourself, or it could be for jobs, or I don't know, a portfolio, whatever you would like. So check them out. I'm going to also put that on my Facebook page as well for that information. All right, let's do some trivia. I know that you're waiting for it. Right. So here is the question. Which two diseases have been particularly associated with poor oral hygiene? Is it schizophrenia and depression, emphysema or pneumonia, diabetes or heart disease, or gout and arthritis? Put what you think the answer is in the comments, A, B, C, or D, and we're going to find out a little bit later who is going to win. All right. So our entertainment for tonight is my good friend Daryl Evan Jones. He is a flutist out in the Memphis area, and this is one of his projects, The Grind. Enjoy. All right, so that was Daryl Evan Jones and The Grind. Tonight we got some very wonderful guests with us tonight. We're talking about Beneath the Surface Cracking Dental School. We're going to now be talking about a little bit. I'm going to find out what our guests think about patient care, clinical insights, and the future of dentistry. And we're going to also be taking some questions from the chat. So if you have any questions, start putting them in the chat so we can look at them. All right, let me pull everybody back up here. There everybody is. Let me take you all off mute. All right. Okay, so welcome back, Dr. Thomas, Dr. Jordan, Ari, and Alon. All right. What are some of the biggest challenges in communicating with patients, and how do you work to overcome them? Anybody?
Well, I guess I'll take that. You have to be ready, and you have to practice, and you have to listen, and then you perform. Those kind of things are in that order. A patient will know, just like Dr. Jordan had mentioned, if you're not confident in what you're believing in or what you're saying, you know. So, and you just don't get that. A lot of times, students are scratching their head or shuffling about, doing whatever. I mean, you just have to be real. Be
Mhm.
real with folks, okay? And if you don't know, find out, but don't just say stuff just to be saying it. But I even asked Alon before we started, when you're treating patients, how are you dealing with that? Because you can't you have to know this stuff. It's just has to come off. You can't BS anybody, you
Mhm.
know. So, and dentistry is a different way of learning. You can't memorize this stuff. You've got to know it. You have to know it cold, and you have to be able to produce.
Yeah, and I think just to piggyback off what Dr. Thomas said, um, what I've been practicing or learning is like things to say to get yourself some time because some people do have complex situations that do require you to kind of sit and think about all the different things. Like, okay, would I prefer their case, right? What are they willing to pay for? What they're looking for? Because sometimes you're trying to figure out how to replace their teeth, and it's something that they can afford, and to give them different options of the process. But a lot of times, people want to know step one, step two, step three. What is it that I have to do? What is it that you expect? What is it that you're going to do? Um, and sometimes for me, at least since I've been practicing the short time that I have, like sometimes that takes me a little bit of a second to be like, okay, let me figure out exactly what I want to say without using all the dental terms that we know, because that also can create a challenge. Where like if I'm trying to spitball out what I know, I may end up spitballing out everything I'm learning in dental school, and it's like, well, that they don't know. There's times where I've said stuff, they're like, okay, what? What did you just say? So that also makes me have to think, okay, well, not saying a tooth number, oh, tooth number 13, like, well, the tooth on the far left in the back, point to that one. No, not that one, the one in front of it. Like different things to kind of make sure they understand or taking pictures or different things like that. Cause communicating with the patient, a lot of times, even if you do communicate it well enough, a lot of times, not a lot of times, sometimes patients still don't understand.
Yeah.
Right? You say, "Oh, you got a root canal on this tooth." What? I've never had a root canal. And then you have to show them on the image. Like, oh, you remember when we did the root canal? Oh, you talking about taking the nerve out? They don't under they that other root canal and nerve doesn't it's not the same thing to them all the time. Um, and a lot of times it takes the doctor to do a good job of explaining it, but not overwhelming at the same time. So yeah, that's something I think I've learned at least these last couple months practicing.
Okay.
That's good.
I think I think what I've like learned just being like fresh in the clinic is that everybody's personality is very unique. And I think that having that in mind, having like different personalities and stuff like that, that's like how like I approach it. Like some patients are like ready to go when they don't want to be here for the full 3 hours, or some that are just like, oh, I'm just so glad that you're doing this for me. And so like how I approach with like treatment planning and trying to figure that stuff out. And I think with that like kind of like helped me in terms of like not picking and choosing like which treatment plan, just like how to like adapt to those specific patients with that. So yeah.
Okay. Um, my mom has a question. She says, "What percentage of dentists are females at our dental school in Illinois and the U.S.?" I'm not particularly sure. I do know that it used to be a predominantly male type of profession,
Yeah.
and it's not that way anymore. But I'm not sure of the percentage. Do you have any idea, Dr. Thomas, on that
I
one?
think in our freshman class, we have more women than men. And
Mm-hmm.
then dentistry back in the day, like I said, I went to University of Missouri, Kansas City. We had, and there was a whole lot of, we had a whole lot of students. It was 165 of us in the class. There were 17 females. Okay. And, but percentage wise, I think that now it's almost even. I still think that there's more men, but it might be 55% to 45%, something like that. But it used to be females were just, oh man,
Mm-hmm.
there just weren't that many. And I always tell folks when I was going out recruiting, it's an excellent profession. And I would say, especially for females. I mean, you can raise a family. You can work as hard as you want to work. You can work 20 hours, 30 hours, 40 hours, but you can still have some time to be with your family, you know, and you're still out there doing things. And, it's a wonderful profession. You can make a lot of money and you can do a lot of things.
Okay. Another question. Cassandra is on here. Welcome, Cassandra. Is there an adjustment period going from dental school into the real world? How has it been?
Hmm.
That's probably a Dr. Jordan and Dr. Thomas.
Yeah, Jordan.
Adjustment period. I guess you mean like going from graduating to like your first day starting. The adjustment period is immediate. It depends. Like it depends on where you're working. Like I work in a private practice with another doctor who I would consider a mentor. So if I kind of have a little bit more confidence because I know if I get into something that I need help or pointers on, I have someone else who's there who's been working for a long time, but also people who are working by themselves. So you go from working and having that instinct of, oh, let me go ask Dr. Thomas. Well, there's no more Dr. Thomas in there. There there is, okay, this person has this issue, this tooth hurts. You're doing all the tests they told you about, and you can't figure out what it is. But the patient does not necessarily accept that
Mm-hmm.
my tooth hurts, and you don't know why. So you have to the adjustment is like I mentioned earlier is the confidence. You have to know that you've done the best job that you can. Because there's gonna be times where you're like, oh, this tooth, I don't want to do a root canal on tooth. I can't treat, I can't diagnose. And sometimes you just have to let the patient know, like, hey, I can't spot anything specifically wrong with this tooth. And you gotta stand confident in that because there's no like I said, there's no Dr. Thomas to come in and go over what you did and then tell the patient what you should have said. You gotta kind of just take it up because it started fast. Like you get a call in with patients, you go from doing a 3-hour appointment, like Alon said, and
Mm-hmm.
now you're doing appointment in 30 minutes to an hour. And then in the middle of that appointment, you got a hygiene check where you're checking, a patient for a comprehensive care or something. And then you have to go back and do another patient and you're writing scripts. And then there's a lot of different things that you're doing at one time. Um, so you kind of like, everything you're doing in dental school is like all crammed into one.
Right.
But you know how to do it. They've prepared you very well for it. So don't
Yeah.
hear all this and be like, oh, I can't do it. You can definitely do it. It's just sometimes you almost go into once you get the hang of it, you just go into almost like a routine of like, okay, let me go do this. In the beginning, it may kind of stress you out or overwhelm you. But you still get it done. You still do a great job because although dental school does provide you with stress, it helps you be able to still perform under stress. So, um, I think my adjustment period to getting comfortable, it probably took me maybe a few weeks, and there's still some things that I'm not gonna feel as confident, I guess, as Dr. Thomas would feel. But that just comes with time, you know.
Yeah, and you're constantly learning. I mean, it's
Yeah.
not something that you just, you don't learn this stuff by osmosis. And differently, and dentistry is totally different now with technologies and stuff than the way that I was taught. You know, I graduated in 1978, so that's a long time ago. Before you guys were born. But it's just totally different. But that's why you're constantly taking courses and you listen to other folks. It's great, Jordan, that you have someone else to talk to. I used to, when I first started out, because I started teaching in '79, so I was just a year out of school, and I would bring some cases in, some models that I had, and talk to some other faculty, you know, and see what they would do and that kind of stuff. So you just have to stay current, and you have to read and just be flexible.
Okay. I have
Mhm.
another question here from Jada. Welcome, Jada. What is the best way to deal with dental fear and anxiety in patients?
It's a good question.
Mm-hmm.
Um,
I
you go ahead, Alan.
well, for me, because I've definitely dealt with that recently with the patient. We were talking about like possible like things in terms of like getting dentures or doing like root canals on different teeth, and they're just like terrified of like having to like just the thought of getting their teeth pulled or even having to go through that. So I feel like just like building that like rapport with your patient over time and just trying to like get to know them, just like asking them how their day is going instead of just like just tossing them. It's like, oh, you're just gonna have to get your tooth pulled. Like that's just what you're gonna have to deal with. Like you lose patience that way. You don't want to have to worry about like scaring your patients off. You want to like express that their fears are actually valid, because I'm pretty sure like before then they've been used to dentists always just pretty much just telling them like the same thing, just it is what it is. So I think just validating their fears and being able to like express that you care, I feel like that'll actually help like deal with that kind of stuff. So that's just my take on it.
Yeah, I would say dealing with the dental fears and anxiety, although it sounds crazy, it's easier in dental school because you have so much time with that patient. Like you're
Yeah.
seeing them 3 hours. You probably only have 10 patients, so you're seeing that patient probably once a week or something. So you really get a good chance to talk with them. Like and private like I was mentioning, like sometimes when I see the patient, I didn't see them in their intake. So I only saw them to take out that tooth that's been hurting them. So when I come in there, the first thing I hear is, "Ah, I hate the dentist." So you
Right,
already know right there, I have to try to hope to make them feel comfortable, but also because it's hurting them, I gotta get this tooth out. Like there's no use scared, but I have to try to do what I can to get the tooth out. I don't have a lot of time to get it done. You don't have a lot of time to, to sit there and wait because we got to get it done. So it's kind of like just you gotta try to read your patient early. Like I just adapted. Like a lot of people are nervous with a needle, so usually like when I'm coming in with the needle, I just cover their eyes without them noticing. Like a lot of times, I think they just think I'm trying to retract their cheek, but I just cover their eyes without them noticing. Because a lot of times, people have been. I was like when I was in dental school, people didn't actually see the needle a lot, but in private practice, I swear, like probably 2 out of the 5
That's weird.
patients, like,
Let me
is
see.
that? Let me see the needle. Can I see it? And,
hey, you wave
but
that
you,
thing in front of their face and it looks like a
it's like,
sword coming at them. you know
yeah.
you know
Yeah, I think in dental school it's very controlled because
yeah.
I've never had my hand grabbed in dental school. I had my hand grabbed a couple times in private practice. It's tough, but you kind of just I don't know. There's different
and,
ways you can handle it. You just gotta figure
and
it
Jordan,
out.
you have to learn to shoot from the hip, you know
Yeah.
but but a lot of times, when I had, when I was dealing with a patient and that's when I had a chart. We weren't dealing with electronic charts or anything like that, but I would write specific notes in there,
Mm-hmm.
ask them what they like, or might talk sports, or just as Alon said, well, how was your day? I mean, just don't. It's not uh, uh, Billy or Bob or Mike. Is Mrs. Jones, and if they want to be called by their first name, they'll tell you. But treat them with respect, and then just talk to them. It just takes a few minutes to do that, and
Mm-hmm.
before you just kind of jump into them. So, well, your tooth number 5 is here. They have a name.
Mm-hmm.
That sort of thing, and so learn to talk to your patients and spend that time.
So I have about three more questions that I really want to get in, and it might take us over maybe 3 to 5 minutes. Is that okay with you all? If we
Yeah,
go
that's
over a
That's
little
fine.
bit,
fine.
okay. Um, Shemaya Newsom, I hope I'm saying your name correctly. Welcome. What is one skill or piece of knowledge you have gained as a current student and as a current graduate?
One skill that I feel like I recently gained is how to like how do I say this? How to not be stuck in like failure. Like whenever I mess up, I'm typically like really hard on myself. But like lately, since being like a D2, I feel like I've gotten accustomed to just like not staying in that place of like, oh, I messed up. I might have to do something over. It's kind of like the day will go on, the projects will keep piling up. Like, you got to keep going. You're going to keep going. You're going to make it out of here. So that's something I've learned how to like navigate as a student.
And you will
For,
be successful.
Thank
Yes.
you.
Mm-hmm.
for sure.
All right.
For
Okay.
me, I'd have to say is probably like adaptability. And I think that's not only just helped me in school and just in life in general. Like like Ari said, in terms of just being stuck. Like say for example, I'm folding laundry or something like that. Let's throw that in there. And I end up dropping all my clothes, blah blah blah. Okay, I'm not gonna just keep dropping the clothes every single time. I'm gonna end up figuring out like why do I keep dropping these clothes? I'm gonna just fix that and then just adapt to it over time. And I feel like I like run into those like different scenarios, like whether it's in the clinic or in just stuff like that. I can't just keep going and running into a brick wall every single time. I need to figure out like how to navigate through it. And I think that like schools help me
Okay.
figure that stuff out. So
All right. How accurate are dental ads that state you can get treated and fitted with a complete set of implants in one day? Is that
I've
true?
been treated and fitted with complete center. But technically, well, yeah, you can get a tooth extracted and an implant placed in the same day. That is doable. But there's also a fine print to that too. Of like you have to like the perfect patient, have the perfect setup to be able to get that type of treatment. So it isn't just like a one size fits all thing. Um,
Okay.
but yeah, and still do your own sort of research a little bit on that too, just because there's always somebody willing to do something. So you still do a little bit of research on that.
Yeah, I mean, the bone has to heal. There's a lot of things that have to take place, and you might get some kind of a appliance, but that might be just an interim kind of thing. I don't
Hmm.
think it's going to be the
Not a
final.
permanent,
No,
yeah,
not
no.
not the final thing, But so just be careful with that, and a lot of that could be some false advertising,
Hmm.
and a
Mm-hmm.
lot of times patients will say, well, the other dentist said this and this kind of thing. You don't want to get into that, you
Hmm.
know, and you want to do. I used to tell people this is what works better in my hands. I just tell them that way. Now they pass a lot of dental offices before they come to me. So if someone else told you they can do this and they can do that, if you feel comfortable with that, go to that person. I mean, it's better to lose a patient early than to get in the middle of treatment and to
Mm-hmm.
get yourself in some litigious kind of stuff. So I mean, if they want to find somebody else and do whatever, usually you can tell when you do your exam,
Mhm.
and talk to the patient as to what you want to do and how you're going to do it. And if they think that they can get it done cheaper or get it done quicker and all that kind of thing, I mean, I'm not going to go into all that, but you have a choice, and there's plenty of dentists out there. So you can't treat everybody, and everybody's not going to like you, but at least you can be fair and firm with them and honest.
Okay. Just curious, has a patient ever accidentally bitten you?
I get bit every day.
Oh.
No, I got no. People, your hands are in there, so you're going to get bitten. A lot of times it's not on purpose. Like, uh, just the other day, I was doing something, and the patient was like slowly closing, but like everything that we do, it has to be dry, right? So I had my hand in there to help prevent it from getting wet. So I saw her jaw closing, and I felt it, but because I wanted to finish it and I didn't want to restart, I just let her I was like, you biting me, but like we gotta get this done. So I just accepted it, and then I told her, "Oh, you're biting me." She's like, "Oh, I'm sorry." And then she opened and then she did it again. But a lot of times they
Yeah.
just don't
Yeah.
Sometimes
realize
they
they're
can't
so
help it.
numb. Yeah, they're
They
so
can't help
numb. They
it.
have
Yeah.
no idea that their mouth is closed.
That makes
Right.
sense if it's numb. Yeah, that makes sense. Thank you, Lisa. Thank you for the question. Okay, one last question. Amina, welcome. What's everybody's favorite memory or part about dental school?
For me, it's just meeting my friends. Shout out to them, the elites. That includes Ari and Rob for sure. Um, Definitely getting to know them. I probably wouldn't be where I am, honestly. Like, I'll probably just be stressed out. Stress is all get out in terms of dealing with that. But then, like, having people like around that are going through these same experiences and asking for advice and stuff like that. Also, shout out to my D4 Alyssa. She's definitely goaded in terms of like helping me get to where I needed to be in terms of dental school. So yeah, I think having them was probably like my current greatest memory and stuff like that, dealing with dental school. So
Okay. My final thing, I want to get put a plug out for SIU SDM. All of you have a relationship. Either you've gone there or you've worked there. So, tell us something. How did I put that? Tell us something. Why someone should consider going to Southern Illinois University School of Dental Medicine.
One, people like Dr. Thomas. You gotta.
That's true. That's true.
There's the student to faculty ratio. There's, I think, one of the greatest things there because I don't have to worry about being one of 300 and only having 30 faculty. I know that there's 7-8 faculty in the classroom and there's
Mm-hmm.
50 students, so I know I have ample people to go to. The clinical experience is second to none. You get the chance to do everything. It helps build your confidence. Like, I never thought I'd be doing as much endo as I do, but
Yeah.
I'm doing it, and I got lucky that I went to a school that I actually did endo on a patient. So when I graduated, it was easier. So I feel like that's the greatest thing about SIU.
Well, I tell students that they do everything. They do a lot, and we teach them a lot. And there's the students get along, and there's camaraderie there. You know, and I would say, and I used to say this when I went to say U of I and talk to other students and their preclinical students and that. I'd say I put our students up against anybody. I think they're that good. They
Mm-hmm.
don't know how good they are, you know, you know. But I would do that, and tell them that.
I see y'all doing this.
What is that? What is that?
I don't know. You were talking there. I'm watching
It's
them.
called clocking it.
Huh?
We was clocking it.
Okay.
Clocking it. Oh. Anybody else? Why STM? Why should someone consider applying there?
For me personally, I just feel like our school has such a family environment, and like you can really get the support that you need, like from other students, upperclassmen, faculty. Like I actually did research there during my undergrad experience, and like every time I came on campus, I was treated well. And I wasn't expecting that, like, just being in the environment of like the dental school that I potentially want to go to. But like, I don't know, it just hasn't changed. Everyone's so helpful, and like they really want you to succeed, and like you really do feel that when you go there. So ooh, go SIU.
Go.
Shemaya, I hope I'm saying the name correctly. Newsom says, I have the utmost respect for each of you. Remember, the level of dedication and focus you have right now is amazing. Do not lose sight of that. Be encouraged no matter what's going on. All words of encouragement. Thank you so much for
Thanks.
that.
Appreciate
All right.
you.
Our final thing is we had a trivia question. And the question was, which two diseases have been particularly associated with poor oral hygiene? What's the correct answer, guys?
See.
C, yes. Diabetes and heart disease. Do we have a winner? Who's our winner?
Amina Haynes.
Amina Haynes. Congratulations, Amina.
Jesus.
So, Amina, you're going to get a nice notebook with a tooth on it so you can put your notes in there, and you're going to get a candle. Smells good. It's a tooth. It's a tooth candle. So we're going to get that to you. What I need you to do is go to my Facebook page and my inbox page, put your mailing address in there, and I will get that to you. Congratulations. All right.
Did she get any money or anything like that?
Yeah, I don't money. Yeah. So the time of the wall says that's all. I really appreciate each and every one of you, Dr. Thomas, Professor Emeritus, Dr. Jordan, D2, Ari, and D3, Alon. Thank you so much for giving up your time, especially on a Friday night. I appreciate you all so much. This was very informative, and I'm sure it's going to help a whole lot of people as far as trying to get into dental school and navigating through it. Are there any final remarks from any of you before we head on up out of here?
I just appreciate you guys so much, and I'm really proud of all of you.
Thank you.
I appreciate you for
Pass
having
me the
it.
tissues.
Yeah.
All right. Next week we're going to have PhDs and EDDs on SIUE on FNL. So if you're interested in getting the doctorate of education or a PhD, come hang out with us. We're going to have some students and some people that have completed the program here on FNL. All right, we are out of here, y'all. Have a great, safe weekend. I think we have a front coming through where we are, so be safe out there. And as I always tell you all, you know the climate, so be careful, be aware of your surroundings. Until next time, we'll see you. All right.
Take care. Thanks,
All right.
Dr. Carter.
Bye.
Thank
All
you.
right, thank you.
That's it.
Bye-bye.
Dr. Thomas.
Okay, bye-bye.